A study released by Northwestern University shows police violence is linked to higher preterm births and heart disease among black women. One of the researchers, Alexa Friedman, joins us to talk about the findings. Alexa, thanks so much for joining us tonight.
Thank you for having me today.
What was the impetus of this study in the first place?
So we were motivated by the recent high-profile killings of Black individuals by police, and we wanted to investigate whether other sources of police misconduct that may be more frequent are also related to, or may also impact health outcomes.
So what other sources, as far as just police force or them being in neighborhoods, what were some of the other things that you found to be a problem?
So in our study, we looked specifically at complaints filed for excessive use of force by police. So this is an event where a person felt that there was an excessive force, that the police used excessive force, and they actually reached out to the police to file a formal complaint for that event.
Now you say, well, it's well known that black women experience disproportionately high rates of preterm delivery and cardiovascular disease, but this new research says that there could be a reason for that. So tell us more about what you found out.
Yeah, so in our study, our team from Northwestern University and North Shore University Health System, again, looking at complaints filed for excessive use of force, and we found that Black women living in neighborhoods where these complaints are more common are about 20% more likely to deliver preterm and about 40% more likely to develop cardiovascular disease as compared to Black women living in neighborhoods with less complaints being filed. And these results were consistent even after controlling for other neighborhood characteristics like violent crime or socioeconomic condition.
When you say complaints, will the woman have had a direct contact with the police for this, or is it just in her neighborhood, in her environment?
No, yeah, that's a great question. We've defined exposure purely based on an event occurring in their neighborhood. It did not have to directly involve them.
Is it because they heard about it? Is it the media? What is it that drives this problem?
That's another great question. We don't know with our research. We can't exactly speculate on that. But as a follow-up study, we are interviewing Black patients about their experiences with police and their exposure to police misconduct so that we can better understand that and try to understand that in future work.
Now, this research took how long?
We're using a cohort of patients across 10 years, and this was our project was about 1.5 to 2 years in the making.
That's pretty significant, 10 years that you have found this. So you're saying that these problems that have happened over the last 10 years, you have found that women are having preterm delivery, that it is affecting the child in vitro.
Correct. That's what we believe is happening, that this is a potential, if our findings are substantiated, this is a potential source of stress that may impact pregnancy outcomes. And that's something that has long-term implications. We know preterm birth affects long-term health and development.
Give me an idea about the numbers. How many women are we talking?
So in our study, we looked at exposure among about 60,000 patients, 60,000 patients with our exposure.
60,000 patients over a 10-year experience. And then not to mention the cardiovascular issues. That's separate from the preterm delivery, right?
Correct. We used a separate cohort of patients for that, about 6,000 women. And in that cohort, we found that women, Black women in particular, who were exposed to police complaints were about 40% more likely to develop cardiovascular disease. And for that, we had an average follow-up period of about 8 years.
What are you, and quickly, because we're almost out of time, but what are you hoping this research does? You know, where's our solution here?
I think that's an excellent question. I think if our findings are substantiated and future research continues to show patterns like this, I think it's important to be aware of police misconduct as a source of stress that contributes to these adverse health outcomes that we're seeing among Black women. And I think it's important that legislators be aware of that. And if these findings are substantiated, that we potentially explore policy-based solutions.
Researcher Alexa Friedman, thank you so much for that research. Be safe, be well.
Thank you for having me.